Cranial mobilization before. We did a medial, a lateral mobilization, and this one would be a medial mobilization. So what I can do is I get over here on the lateral part of her paraspinals, and what I'll do is as I push medially, I'm really hiking her left hip, which is taking up some slack on those tissues. I'm sorry, releasing the slack on the tissues.
Can you repeat that?
So I'm on the lateral part of the paraspinal tissues, and as I go, and I use my thenar or hypothenar eminence. Right now I'm using my thenar eminence, and I start here and I'm going medial, and as I go medial, I'm hiking her left hip to take some of the slack off of that muscle. Is that okay? And then, if she had a lot of symptoms, I may start just nice and easy. I may start with an oscillation just to get her relaxed. And then as I go, I can put more and more pressure. Now, one thing that I'm doing is my pressure is medial. So as I'm here and I'm going medially, once I get to the most medial part, I stop, and I don't have to pull my hand off the skin, but really I'm not putting any pressure on the muscle as I'm starting from this lateral position again. Okay? And then if I want to come up this way, if I want to come a little bit more cranial, then I just move over here. May have to give her a little bit more of a side bend of the hip. If she has a lot of issues going on, then that she may not tolerate the palpation over here. She has some guarding of her glute muscles or piriformis. She may not tolerate that. So let's say I want to do both sides. I want to do a medial, and I really don't want her to flip. She may be a little bit older or just a lot of pain and has trouble getting from side to side. Then one thing I can do is here, pull you up for this one. I can just reach over, instead of having her flip to the other side, I can just reach over to the other side. And what I'm going to do with her hip now is I'm going to bring her left hip downward this way as I do the mobilization. So I take up the slack. And so I'm still doing a medial mobilization. Just on the opposite side. This one's a little bit more difficult, so if I had my choice, then I would do it the first way, going from the top. If she's sideline, whatever side's on top, I would go downward rather than pulling toward me. But that's another option. Any questions with that?